Great. Thanks, David. First of all, welcome everybody. Thank you for making the time to join us today. The purpose of today's webinar is really to discuss providing rapid response services during the COVID-19 national health emergency. We hope to provide you with some updates about information about what's going on at the state level, have some discussion around the delivery of rapid response services, what's happening in Region 5 states, in the Midwest, and hopefully share and talk about some information related to best practices. I am joined today by my colleague at Dceo, Brian Ellis, who is the Southern Regional Manager, and we're going to be kind of tag teaming today a little bit about our presentation. And we also have with us representatives from the U.S. Department of Labor, the Employee Benefits Security Administration. Lisa Schromek is joining us. And also, there's a number of folks from the Illinois Department of Employment Security joining us today, and they will, Justin Brissett, who is the UI Program Director, as well as Deb Potts, who is the Northern Region Employment Services Program Manager, will share some information on laid-off worker benefits in relation to unemployment. So we scheduled this webinar to be about 2 hours. I'm not sure how long, it's just depending on our discussion, how long that takes. But let me run down, first of all, kind of a list of the topics that we want to cover. David, you want to switch to the next slide, please? Okay, so there you see kind of what we're hoping to cover today. So we'll start off. I want to give you a little bit of background information on where we're at with the state in terms of rapid response. We will also talk a little bit about funding opportunities, although that's not really the focus of the call today. We just wanted to give you, share some information for some of those who may not have that information already. We also wanted to share information about what other states are doing in terms of rapid response. We will talk about kind of our rapid response process in terms of, the shelter-in-place order and how we go about delivering information virtually. And then we'll turn it over to the EBSA, Employee Benefits Security Administration, for some updates related to employee benefits there. And then we'll have IDES present some information. And toward the end of the call, we'd like to open up the phones, and we'll kind of do sort of an LWIA roll call. So if you have information that you'd like to share with the group about some of the things that you're doing that you think are working well, or some of what your challenges are, we'll have an opportunity to do that. And also, we had asked that people submit questions prior to today's webinar, and some of you have done that. So we hope to address all of them throughout the presentation, and then at the end kind of address any questions that we may not have gotten to in the course of the discussion, and provide you with some answers related to that. I guess as a reminder, one of the things, and I know you're all very well aware of this, but information is updated on a daily basis. So we may not have answers to all of your questions. And I did note that a number of questions that came in, or a few questions that came in are, you know, program related in terms of what's allowable, or can we get some relief in a certain area. And I wanted to just make you aware that Dceo submitted, I guess it was about a 3 to 4 page request up to DOL asking for, I guess you would call it administrative relief on some of the requirements that relate to our delivery of services related to, you know, grants and reporting deadlines and funding and expenditures and things like that. We don't yet have a response from them on all of those questions, but I'll try to point those out as we move forward. With that, let me give you a little bit of background information. David, if you want to switch to the next slide. There you go. Thank you. So, you know, typically rapid response process starts out with notification. We find out that there is an event, and what you see up on the screen is some information comparing this month, March 2020 compared to March 2019 in terms of the volume of notices and workers that are impacted. So obviously, you know, this is unprecedented. And we are working desperately to get the WARN notices out as quickly as possible. Typically what happens is the WARN notice gets sent out to the field, and the desk event is set up right away. Given this volume, we are backlogged on building desk events, and we'll talk a little bit more about that later, but wanted to just let you know this is the kind of numbers that we're looking at right now. You can also see that there is a difference. There's a lot of temporary layoffs being reported, or furloughs, and we'll talk a little bit more about that in a little bit. But right now I'm going to turn it over to Brian Ellis to talk a little bit about what some of the other states in our region are doing, and a little bit about funding opportunities. So you want to flip to the next slide, and I'll turn it over to Brian.
Good afternoon. Thanks, Annie. Welcome, everybody. So just wanted to share a little bit of information about what's going on in our region, Region 5. So as you know, the Workforce Innovation and Opportunity Act requires us to deliver on-site rapid response services. However, in light of the COVID-19 situation, DOL has indicated that states have flexibility in whether to provide rapid response in person or through other means. So if LWIAs are considering, which I don't think anybody really is at this point, but if you are considering on-site rapid response services, you know, you should consult the CDC guidance, the Illinois Department of Public Health, and local government directives for large gatherings. So Annie and I participated in a dislocated worker rapid response DOL Region 5 conference earlier this week. So just wanted to share some of that information, like I said, what other states in our region are doing in terms of rapid response delivery. Some of you may have already implemented these methods, or maybe some of these will spark other innovative ideas as we move forward. So as you might expect, the states in Region 5 indicate that so far most of the reported layoffs are temporary in nature. So, you know, LWIAs in other states are referring companies and individuals to resources like unemployment or small business administration loans and resources and other things that might address their immediate needs. So all of the states basically have stopped delivering in-person rapid response workshops. And they've transitioned to delivering rapid response through virtual methods like WebEx and Zoom, and I think there were some other platforms that were mentioned. States are also delivering packets of rapid response information to employers to distribute to employees, or sometimes they're providing it to employers electronically to distribute to their employees. Some states are even exploring ways that they can deliver virtual statewide job fairs. I think one state actually recorded a rapid response orientation video and they posted it, online. A couple of states are working to develop a chat function on their LWIA websites so they can be more responsive to individuals' questions as they come up. Next slide, David. Okay, so during this webinar, we primarily wanted to focus on the delivery of services but just wanted to let you know, if you didn't already, that Illinois is in the process of applying for additional funding. And we've submitted initial requests to the U.S. Department of Labor to provide employment and training activities and disaster relief employment, which includes humanitarian and cleanup assistance. So Illinois is also working to develop a second workforce application that's focused on the economic recovery phase. It's anticipated that Illinois will request additional funds from the U.S. Department of Labor to provide essential skills training targeted at specific industries, including but not limited to hospitality and restaurant workers, where low-skilled and low-wage workers have been disproportionately impacted by COVID-19. So finally, the department is working to identify existing 1E and statewide activity funds to target specific layoff aversion projects that will provide immediate relief to employees that are at risk of losing their jobs. So stay tuned for some more information. But for now, I would just want to turn it back over to Annie to talk about the virtual delivery of rapid response information. Next slide, David.
Okay, thank you. Brian mentioned, DOL said, you could provide information on rapid response. If you couldn't do in-person or on-site workshops, you could deliver that information through other means, and wanted to talk about what other means are, especially in light of so many of the notices that we're getting are for temporary layoffs, and whether it's temporary or permanent, often the employees have already been let go. And so what we have been doing, the Dceo rapid response reps, when it's a state level event, and just as a reminder for anyone who wasn't sure, if the event involves 25 or more impacted employees, that's kind of called a state level event, and the Dceo rapid response rep is responsible for coordinating those efforts. And if it's less than 25 people, that's considered a local event, and so the LWIA rapid response representative is responsible for coordinating those. But what we have found in our outreach to employers, which we're trying to accommodate, within 48 hours of receiving the notice, but a lot of employers are just asking us to email to them the rapid response packets of information that we would typically hand out in an on-site workshop, and we send that to the employer, and then they in turn distribute to their employees. And then often, or not often, but we are also offering up the opportunity to do virtual workshops, kind of like this Zoom webinar, where the rapid response team would provide information to the participants via webinar. And the state rapid response rep, the Dceo rep, is responsible for coordinating. We're working with the Illinois Worknet team to set those workshops up. And for those of you who have had an opportunity already to work with your Dceo rapid response rep, you kind of know basically what happens is the Illinois Worknet team will set up the Zoom call-in information, and then we provide a flyer or that information to the employer to distribute to their employees. We also have the ability to send that information directly to employees ourselves, so long as the employer can provide us with their email addresses. And we've worked with the Dceo rapid response reps to kind of coordinate how that will work, but just wanted to let you know we do have that capability. One of the questions that has come up, there were a couple of people have asked, is can we get employee lists when we do outreach? And that is typical of our normal rapid response procedures. We do ask for employee lists for the purpose of outreach. Some employers are willing to hand that over right away. Some are hesitant to give that, or they don't have access to it. And then we're finding some employers who actually have policies against sharing that employee information. And we'll talk in just a second about how we're kind of handling that part of outreach. But we do ask for it, and when we get them, we will definitely share them with the LWIA staff. One of the things in doing a rapid response workshop via webinar that we have thought about, I know that some LWIAs do this on a regular basis and some may not, but when we do the webinar, it's helpful to have slides for participants, you know, to view contact information and other things. So if your LWIA hasn't already put together a rapid response presentation, that's something that you might want to consider. And then along with that, you know, in normal circumstances, the LWIA directs traffic to the American Job Centers typically, and obviously they're not open right now. So special consideration needs to be given to how we direct participants to engage with the system. I know Brian mentioned some of the things that other states are doing, and I know in some of the surveys that you all have submitted to us, you kind of outlined some of the things that you're doing. I know you're doing a lot of Skyping and Zoom and other conference call type things, but giving some consideration in your presentation to how you're directing workshop participants to engage with the system. If you're interested in doing a Zoom webinar and you want some technical assistance with that, the Illinois Worknet staff has been really great at helping us put these things together, and you can certainly reach out to your Dceo rapid response rep if that's something that you're interested in coordinating, and we'll get that worked out for you. they will, like I said, set it up for you. They can help drive the presentation when it's actually happening. So that works out pretty well. And then the slide also we mentioned, I wanted to backtrack a little bit on the building of desk events and company-specific layoff pages. So, you know, when a warn comes in, one of the first steps that we do is build a desk event within IWDS. But because of the volume, that has been delayed, and the desk event has to be created before the company-specific layoff page can be created. Again, we're working desperately. We have a team of people who are working to build desk events, and so I hope that we're caught up relatively quickly. But in the meantime, if you find that you have a workshop coming up and there is a high priority to get this company-specific layoff page built, I would ask you to either reach out to your Dceo rapid response representative, or to Brian or me, and we can expedite that for you. As part of the Zoom webinar workshops too, what we've done, you know, because it's one of the things that we do in workshops typically is to have a sign-in sheet. And I know a lot of LWIAs use those sign-in sheets after the workshops for outreach purposes. And so what we've done with that piece of it is set up the rapid response participant surveys in SurveyMonkey, and we will put those, you know, include that as part of the rapid response workshop presentation on Zoom. And when people respond to those questions, the outcome of that, we collect all of their responses and we can put it in an Excel spreadsheet for you. And the Worknet team will share that with the Dceo rapid response rep, who will then in turn share it with the appropriate LWIA or LWIAs, whatever the case may be, for outreach purposes. And those spreadsheets can be sorted and filtered and whatever makes sense for you. One of the questions on the survey specifically asks people, would you like someone to reach out to you? So you'll see those responses along with their contact information and their responses to questions about what their immediate needs are or what their interests are. So again, you can reach out to your Dceo rapid response rep if that's something that you'd like more information on, or something that your LWIA would like to participate in. And I think in terms of the virtual delivery of information, that's kind of where we are on the state level rapid response. We have had meetings with the, like I said, the Dceo rapid response reps, so they're all pretty familiar with this process. So if you have questions about that, certainly reach out to them. And we're going to switch gears here for a minute, and I'm going to turn over this presentation to Lisa Schromek, who is, again, from the Employee Benefit Security Administration at the U.S. Department of Labor. So you want to go ahead and take it away, Lisa?
Sure, thank you, Annie. And thank you, everyone, for allowing us to participate. As Annie mentioned, my office is one of several federal agencies under the U.S. Department of Labor umbrella. We are the Employee Benefits Security Administration, or EBSA for short. And just in case you're overwhelmed enough as it is with your own agency's acronyms, and the DOL acronyms are confusing, I will clarify that we are not actually the agency involved in funding rapid response activities that were mentioned earlier in this webinar. Rather, we are the agency that kind of is on the ground providing information at rapid response events. And I, along with 8 other of my team members in the Chicago regional office, frequently work with Annie and her team in delivering these presentations. And like she said, you know, we've definitely switched over from the in-person to doing the webinars, and we have done webinars on occasion. So luckily, we were kind of already prepared and practiced to be able to carry it out in this current environment. And so I don't know if I have the ability to switch to the next slide, or thank you. So in case you're not familiar, or just as a brief refresher, we are part of the general team that talks about the portion of layoffs that relate to employee benefits. So when someone loses their job, how it affects their health benefits, how it affects their retirement benefits, and kind of general reminders about taking care just to preserve those benefits, as well as to just make the best choice for yourself going forward. Of course, not always knowing what the future might hold. So that includes information on rights about COBRA, about HIPAA special enrollment, and just kind of retirement plan reminders. And we also just don't like to overwhelm everyone there when they're generally sort of already stressed about other things and maybe primarily focused on applying for unemployment benefits. So we always like to provide this contact information and let people know that the EBSA benefits advisors are always available to take a call for additional clarification, or to ask a specific question related to an individual situation. We can assist people with our toll-free number. Even though all of our offices are currently closed as well, we have internet-based phones, and our toll-free number routes those calls to people to be taken at home. So that's how we're working right now. We're also addressing website inquiries where someone can submit it with this first link here, the dol.gov/agencies/EBSA ask a question. And then we're no longer handling walk-in visitors, and our website even has a disclaimer now, as I'm sure many offices do, where we're primarily conducting business for the foreseeable future just via email and telephone. So that's just the adjustments that we've made, and beyond sort of just the general information that we tend to distribute about COBRA and HIPAA and ERISA and the laws that have existed for a while. I know that everyone is anxious to hear maybe a little bit more about some of the new federal legislation that has been coming out, and so as you see on the bottom of the slide here, I have a link for a new page on the DOL website, the general DOL website. So this is where they are posting links to kind of collective updates on workplace-related topics from various DOL agencies, including OSHA, including Wage Hour Division, even a little bit of information about federal law and how it relates to unemployment insurance, and how there's new guidance outlining state flexibilities in administering their unemployment programs. And there's a link to support for dislocated workers and states with the ETA. And so there's just a lot of good information. That's probably a good first place to go. And then along with that, another sister agency has a special page about the Families First Coronavirus Response Act. I didn't include that here because, you know, I'm not an official representative of that agency. I can't technically talk about it, but as is the case with federal legislation, something that is recently enacted may actually be required to be jointly enforced or administered by different agencies. And so we all kind of have to know a little bit about it in order to work together and collaborate. And I did also want to mention, because I just heard from the supervisory benefits advisor in my office today, Cindy Saba, that she did have a call with Mr. Gerardo Lara from ETA Region 5 to discuss and coordinate collaboration on state rapid response on a regional and a national level, so that, you know, we're all slowly working to try to implement all of this, and how it may kind of tie in, and so for now, again, this is just kind of a general introduction so that people know where you can send someone that has questions for more information, whether that's an employer that's seeking information on resources and support at this time, or an individual participant, employee who has been laid off. And so one thing that was hosted on March 20th was a special town hall meeting sponsored by the DOL's Wage Hour Division about this Families First Coronavirus Response Act. And that really just kind of focused on getting feedback from the general public about the new legislation that was enacted to extend paid medical leave and family care leave with, you know, either for illness or for caring for a family member that's affected by COVID-19. And they were gathering comments, not answering questions at that moment, in order to kind of prepare to work on guidance that they would be releasing. Well, that guidance is now released. I do see that Wage Hour Division has created a new page, which is just an extension of their normal website. Their normal website is www.dol.gov/agencies/WHD for Wage Hour Division /pandemic. So on that web page, there are links to fact sheets, questions and answers, posters, and even a field assistance bulletin. And they will be updating the guidance and clarification as necessary, but that's finally there. And we also received in my office the EBSA guidance about the new CARES Act. So the CARES Act is an acronym for Coronavirus Aid, Relief, and Economic Security Act. And we did receive sort of a little bit of brief internal guidance, just so we're aware, and I think additional clarifications and guidance is still being issued, but I'd like to share some of that with you today as well. And the reason that this kind of ties in is because Section 3201 of this CARES Act expands and clarifies certain provisions in the Families First Coronavirus Response Act. That FFCRA was enacted on March 20th. And in addition to that leave, I think it also had a provision for no-cost coronavirus testing. And how that ties into EBSA is because, of course, we oversee the laws that regulate employer-sponsored health and retirement benefit plans. And since most people, and a lot of people, I don't know if I can say most, but certainly quite a lot of people have their health insurance through their employers, that's why we were made aware that we would be responsible for enforcing those provisions of the CARES Act, which would require the employer group health plans to offer no-cost testing and treatment. So that provision of the CARES Act is effective immediately. It requires group health plans and insurance issuers to provide coverage with no cost sharing, including deductibles, co-payments, and co-insurance for COVID-19 diagnostic testing and related services. And one other interesting point about that is that there is no longer a requirement for diagnostic products for COVID-19 or the tests, the different variety of tests that may be available, which to be approved by FDA when administered during this emergency period. So even if something is still in kind of an in vitro status or in testing status, but it's available just, I think, because of the shortage of testing, there's temporarily no longer an approval requirement by FDA as an excuse for a plan not covering costs related to a test. Section 3202 of the CARES Act requires group health plans and health insurers to reimburse providers for all coronavirus testing and related visits based on a cash price that the provider must list online unless they have a negotiated rate with an insurance company. And with this, an interesting point to note is that testing providers who don't list their prices online could be penalized a maximum of $300 per day, and this particular provision will be enforced by U.S. Department of Health and Human Services. Section 3203 expands the category of preventive services, which, as you may know, according to the Patient Protection and Affordable Care Act, must be covered at no cost or copay under a plan. So it expands this category to accommodate vaccines that may exist or be developed to combat coronavirus. And so group health plans and health insurance issuers shall cover any qualifying coronavirus preventive service free or without cost sharing within 15 business days after recommendation from the Centers for Disease Control Advisory Committee on Immunization Practices. And Section 3701 amends the Internal Revenue Code to allow a high deductible health plan with a health savings account to cover telehealth and other remote care services prior to the patient reaching the deductible. So that is also new. Sections 4112 and 4113 of the CARES Act will provide relief to the airline industry, including procedures for providing payroll support for certain airline industry companies to continue to pay for furloughed workers, including wages and benefits. And this particular section provides apparently $32 billion in financial assistance for the exclusive use of employee wages, salaries, and benefits within the airline industry. So those are generally the provisions of the CARES Act that apply to health-related concerns, and for which you may hear of questions. And of course, you're welcome to direct those questions to my agency for more assistance, because that's really all we know now, but hopefully we'll know more in more detail soon. And then there is also a section of this Coronavirus Aid, Relief, and Economic Security Act, or CARES Act, relating to retirement plan benefits. And the Section 2202 includes several special retirement plan rules, including the ability to withdraw up to $100,000 from retirement plan accounts for coronavirus-related distributions with a 3-year repayment window. So this kind of obviously relates to tax relief, because if the 3-year repayment window is followed, then there's no tax on repayment of that loan. It also provides the ability to withdraw if an individual or their spouse is diagnosed with COVID-19, or if the pandemic hurts their finances for instance, because of a layoff or furlough in the family. And the loan limits up to $100,000 if certain conditions are met, is an increase over the current limit, which is $50,000 or half of the account's value. That's the current rule. So this is the amendment up to $100,000. And this section also provides the ability to delay by a year certain other retirement plan loans that were due by December 31st of 2020. And it also addresses plan amendments that are needed to comply with this section. So employers may have to amend their plans or provide more information and disclosures in writing to their covered employee plan participants. Another section, 2203, temporarily waives minimum distribution rules for retirement plans. Section 3608 relaxes single employer plan funding rules and gives employers more time to meet their funding obligations, most likely with respect to traditional pensions or maybe an employer match. And Section 3609, they mentioned it to us, although it doesn't necessarily apply since this is relating to non-ERISA plans, but it is related to a retirement plan in that it expands the definition of cooperative and small employer charity pension plans that are already subject to less stringent funding rules as they're considered non-ERISA plans. So that is what we know about the CARES Act and how it has amended the Families First Coronavirus Response Act with respect to health and retirement benefits. I think the only other update that I have now to share is that we are now also getting some inquiries from individuals who remember the COBRA extension and the subsidy that was made available following the financial crisis of 2008 under the American Recovery and Reinvestment Act. And so we are still waiting to hear if something like that might become available again, but we don't really have any answers yet. And so, if you get any questions involving that sort of issue, feel free to direct the inquirer to our office about that as well. And I think that's pretty much all I have. So I'm ready to turn it over to unemployment, I believe.
Actually, let me jump in here, Lisa. This is Annie. Thank you so much. I appreciate that. I wanted to just quickly mention for those who may not already be familiar, but Lisa and the team at EBSA are the people that our rapid response teams in the northern region engage for participation in rapid response workshops to provide the employee benefit information. I do know that in the central and southern regions of the state, that information is typically handled by a representative from the Illinois Department of Insurance. But when I was speaking with Lisa about preparing for this webinar today, she did indicate that anyone can reach out to the EBSA staff, regardless of where they're located in the state, if you need assistance or if you have individuals that you want to direct their way, regardless, again, of where they're located, they will certainly take those calls and help out.
Absolutely. As a federal agency, we have different regional offices, mainly for enforcement purposes and also for, in case we have to travel, that we're not traveling all over the U.S., just within sort of a limited jurisdiction. But anytime someone is calling for information or assistance, they can get the same information from any regional office. So they are not even restricted to calling 8:30 to 5 in their time zone. If they call after hours, our office on the West Coast will still be open, and the toll-free number will route the call there. Or if they're calling earlier, it might be already within operating hours of the East Coast offices, so the call could be routed there. So there really is, no restriction as far as where you call for this information. And just because someone is laid off in Illinois or in Region 5 doesn't mean that they can't get this same information from other regions. We are definitely working to, educate everyone simultaneously and also collaborate with the different DOL agencies involved and make sure that we're giving consistent information. So yes, thanks, Annie.
Great. All right, thanks, Lisa. So we're going to switch gears again, and I want to turn it over to our partners at the Illinois Department of Employment Security, Justin Brissett, the UI Program Director, and Doug Potts, the Northern Region Employment Services Program Manager. So you guys want to go ahead?
Yes, hi, this is Justin, and I'll begin. And thanks so much for having us and the wealth of information that you've been able to pull together on this forum. So we do appreciate it. There are a small handful of IDES folks online, but for today it'll just be myself and Doug Potts presenting. And Doug will cover the Reemployment Services Program. I'll discuss more about the UI benefits and what we've been experiencing as an agency over the last several weeks. So almost on a daily, but certainly a weekly basis, we have state representatives and business groups and other entities reaching out for rapid response like information. Primarily, they're interested in helping their constituency, whether it's the employer or whether it's a group of claimants or employees, understand the unemployment insurance process better. So, for example, last week we hosted a session for the Illinois Manufacturers Association. Later on this week, there is a session that the AFL-CIO has put together, and even yesterday, one of the state representatives invited us to a telephonic town hall. And so more of these pop up than we can actually handle. We are short-staffed at the moment. Because a good number of our staff are shelter in place, and so on top of that, over the last just in the month of March, we've seen tens of hundreds of times over the amount of claims that we saw during the same period last year. We're just to give you sort of a rough example, in 1 month we're taking nearly the amount of claims that we would take in about a year. And I know the U.S. Department of Labor and then our labor market information group is posting some more of those numbers online. So there's plenty of people filing claims right now. We have our call center operations at the max. Over 90% of claims are being filed online at this point, and I would expect that number would continue to grow. So some of the things that we've been sharing with some of these employer groups and other state representatives is some of the typical information that we would share under normal rapid response circumstances. Some of the same things that Worknet has posted on their individual employer layoff assistance links. So for example, whatever you workers should know, we have that in English and Spanish, and then the other one is, I filed my claim, what happens now? We have that also in English and Spanish. You may have noticed on our website that we have a COVID-19 related FAQ. Most of the questions up to this point have primarily been focused towards the claimant population. And so we're working to finalize an FAQ that's more directed to the employer community. So in terms of the unemployment insurance program itself, for the most part, it has not changed drastically, but there are some key changes that have been made in order to facilitate the processing of claims and payment of benefits, which of course is our main concern right now. So as this group might all know, a couple of weeks ago, Governor Pritzker, through an executive order, waived the wait week effective with the week beginning March 8th, 2020. Typically, the first eligible week of the claim is non-payable. So what that executive order did was to make that week a payable week. So instead of what is normally a 1 week worth of a payment, the first payment is, and every payment thereafter is 2 weeks worth of benefits. So some of the other things that we've done has been to relax the enforcement of registration with our employment services program. However, we are still strongly encouraging people to register, and there are still plenty of people registering with Illinois Job Link. We are, on the other hand, still enforcing our RESEA program, the Reemployment Services and Eligibility Assessment Program, which Doug will speak to later. We have relaxed our work search requirements in certain situations, and I'm willing to address some questions surrounding that if people have any. What we cannot really relax, but what we've done is basically clarified our requirement that individuals be able and available for work. So what we're encouraging people to do as we're speaking with them is to consider the different types of work that they may do from home, so remotely, even if they've not done that sort of work before, but perhaps they have those same skills. In terms of employer chargeability, there's been a lot of questions surrounding that, and at this point, employers are still liable to pay unemployment insurance benefits. Typically, we charge the last employer for whom the individual worked for at least 30 days. And so perhaps people might want to know about how the CARES Act intersects with unemployment insurance. I know there's been a number of questions that came in advance of this session, and you all might have some right now. We don't have all the answers, but just to speak to some of the main programs that we will be standing up. So there's the PUA, which is the Pandemic Unemployment Assistance Program. And I know there was a question regarding this program as it concerns what I'll call truly self-employed individuals. As we know, there's a number of people who are misclassified, but this program itself is intended for those who are truly self-employed. It lasts for 39 weeks, and it's effective January 27th through the end of this year. There's also the Pandemic Emergency Unemployment Compensation Program, PEUC, which provides for a 13-week extension, and that program sunsets also at the end of this year. The other one, which we are standing up effective this week, now that the governor has signed the agreement with the USDOL, is the FPUC. And so that provides for an additional $600 per week of benefits. And it's effective this week, and it lasts through the end of July, so July 31st, 2020. It's not considered wages, however, it is taxable. So with the $600 FP for benefit payments starting next Monday, and we expect to begin paying out those $600 additional per week beginning then. And now I'll turn it over to Doug Potts. Thank you.
Hello, everyone. I'm here to talk about the Reemployment Services and Eligibility Assessment Program. This is affectionately known as RESEA, and many of you are familiar with this program. This program continues to go on even during this period of COVID-19. We are still providing the services. All services are being provided over the phone. Our staff is calling each individual client over the phone and providing them services over the phone. So we're giving them the information. We are effectively doing the workshop over the phone. We are doing what's called the individual reemployment plan over the phone. We are making referrals to different partner agencies. All of our staff have referral forms from their different locations, and they are providing those referral forms to the partners for services, so services can be followed up on. We are still providing them orientation to the American Job Center and the services that are available. We're providing them specific labor market information in regards to the careers that they may be interested in. We are still developing, and we're still developing that individual reemployment plan to assist them in getting back to work. So we are making every effort to contact those people. So everything that we're doing right now is taking place over the phone, and we're finding that it's very successful. And the reason being is that they don't have anywhere else to go. So we are able to effectively get a hold of the clients and provide them the RESEA, the reemployment services, via the phone. And we continue to do that successfully. I do also want to mention that they should be registered. We want to have them register with Illinois JobLink. When we do rapid response, we want to make sure that individuals are registered with the Illinois Job Service, which is illinoisjoblink.com. There are employers out there during this period of time that are hiring and that are looking for people. So we've opened that up to allow individuals to let them know these are the employers that are hiring during this time period. Yes, they're not great jobs, but they're jobs nonetheless, because we know a lot of people right now just need employment, and they can't wait. They can't wait on the government to provide them the assistance that they need at this point in time. Even with as fast as we're processing unemployment insurance claims, they still need some kind of support. So we have put a list together of a bunch of employers that are hiring, and that we are able to offer employment assistance to them during this period of time. Many of the rapid responses, as I've seen across the state, are being done virtually, and we're still providing the same information in regards to employment service. Employment service is alive and well during this time period. We're still out there helping our employers, and we're still putting people to work. Okay.
Doug, was that all you had?
That's all I have.
Okay, perfect. Thank you so much. Appreciate that. I noticed that there were a couple of questions in the chat pod that related to unemployment. So wondering if we could, I don't know if you guys can see those, but was wondering if maybe you could address some of those now. Let me see, I can't, let's see. So one of the questions is, would employees who've been laid off from a religious-run daycare that has not paid into IDES be eligible for expanded IDES coverage?
So I know the PUA program, I know I only mentioned self-employed individuals, but it is meant for more than just self-employed individuals. I can't speak to that particular group. I know that the Act does speak to individuals employed at companies that don't typically pay into unemployment insurance.
Okay, and then the next question is saying, IDS, do you have plans to translate your materials into Polish, Mandarin, or any other languages? You know, if that's in the works, or? So
right now we have very few, well, let me just say not all of our material is translated into Polish. Most of our main material is translated in Polish, and I know in the chat box we have the two brochures that I mentioned that are posted there, and that's just the English and the Spanish version. I believe we have the Polish version of the I filed my claim what happens now, and I have a set of brochures that were translated and sent to me this morning. I haven't had an opportunity to look at them. I'm assuming that they're translated into Mandarin. But I don't have that whole list for you right now. The online claim itself, we have that in English, Spanish, and Polish only.
Okay. And the next question is the FCOC proactive, I think it means retroactive, for individuals who were dislocated before the COVID-19 epidemic. I thought I heard you say that was actually effective this week. So does that mean, you know, for layoff dates that are this week or after? Or could you clarify that?
Right. It's basically anybody who, the data claim doesn't have to be effective this week. They just have to be collecting benefits. With this particular section of the Act, it was not made retroactive. So this is the first eligible week. And I know there's another question related to whether the $600 payment is taxable, and yes, it is taxable.
Okay. Oops, I lost it. The next question has to do, is there an FAQ sheet available for the PUC or the SUC?
We're working on it.
Okay. And then for an employer considering keeping workers home 1 week, then back to work for a week, and then home for a week, and so on, would those workers file a claim, close it the next week, and reopen the following week, and so on, or do you have a recommendation for that?
That's exactly what happens even prior to now. So
Okay.
the claim lasts for 52 weeks, and for the regular benefit program, 26 of those 52 weeks are payable. So some people go straight through, and that's a 6-month program, and then other people, like you mentioned, perhaps they file a claim and they collect 6 weeks straight, and then they go back to work for a number of weeks, and then they're laid off again, and then they come back into the system. And under that same claim year, they still have 20 weeks available. That's just under the regular program.
Okay. Next question was, I'm getting calls of people who are still within the benefit year but have exhausted regular UI, are not being allowed to file for any extension or additional benefits. Can you comment on that?
So if I look at that plainly, and they're still in the benefit year, and they've exhausted, since the ink is barely dry. I think the governor signed the agreement. The president signed on Friday. I think the governor signed the agreement on Saturday. So just a few days ago, and so we don't have the extension program. We don't have the infrastructure for that program built quite yet. But what we will be doing is, since we know who those people are, we will be reaching out to them once the program becomes available for payment.
Okay, thank you. And then next question, are small business owners considered truly self-employed?
It's kind of a loaded question, and in part it depends on how they have their business entity set up. So we could look at sort of some individual questions offline, and that might be a good one to add to an FAQ.
Great. Okay, thank you. Next one, are folks who have been furloughed or put on a reduced hourly schedule due to COVID-19 eligible for UI benefits? Wasn't sure, given that they technically are not unemployed.
Yeah, that's another good question. So, and the answer is, it depends. So let's just take the example, maybe best case scenario here as far as eligibility for benefits. The maximum weekly payable amount for regular compensation is $484 a week. So if we're saying that that furloughed person or the person who is on a reduced hourly schedule is earning less than that amount, then yes, they would continue to work their reduced schedule and collect benefits. So as soon as their payments are greater than the benefit amount, then they're simply not eligible.
Okay. When will self-employed individuals be able to file a claim? I believe as of a few days ago, the regular application was not yet set up to adhere to those types of individuals / claims yet.
Okay, and it looks like there may be a similar question following that.
Yeah.
Okay, so let me see if I can capture both of those questions. So, you know, people who are not working, they should be filing a claim for benefits, whether it's regular benefits or whether it's those self-employed individuals. They should be filing now, even though for the self-employment program we don't have that that program. We don't have the infrastructure for that program set up quite yet, and so you know, on the other hand, when an individual chooses to file a claim, it's completely up to them. We will not refuse a claim. We're not in the business of refusing claims. And if people are filing for benefits right now, even if the self-employment program is not set up, at least we know or have a good idea of who those folks are, rather than them going away and possibly either not coming back into the system or waiting and then having to concern themselves with either starting it effective that week or the possibility of some sort of backdating of that claim. And as far as this next question here, so eligibility for regular benefits is basically the primary program that we are looking to put people in. And then when they're not eligible for that program, then for example, the self-employed person would be, they would go into the that federal program. But it's not, at this point, it's not a separate application. People who are not working, they can file a claim now. The other thing I wanted to mention is that we're waiting for some guidelines coming back from the U.S. Department of Labor because they have mentioned that there is some hierarchy, which I just alluded to, amongst these varying programs.
Okay. And it looks like there's one more question. What's the best suggestion for someone that's not able to file online, or the online application is denied? You know, there's a you know, are there alternatives to online filing at this time?
So the alternative would be to call our call center. And I know that, you know, as every state across the nation has been experiencing overwhelming demand and load on their technical platforms, we have actually expanded our platforms That's not to say that some people won't have some complication for some reason or another with filing online. And there are actually some legitimate reasons why we don't allow some people to file online. But as I mentioned, over 90% of all of our claims are being taken online, and we are encouraging people to file online and as an alternative to call our call center.
Okay, great. I think that's it for the IDES questions. Thank you both so much for joining us and giving us that information. What we wanted to do next as part of this webinar, we're going to try this, see how it works. We wanted to hear from you, from the LWIAs, and get a better sense of what you're facing in terms of large layoffs, what industries are being hardest hit in your local area, and would ask that you share that information with the group and how you're handling the delivery of services, given that AJCs are being closed to the public, and how you might be directing traffic. I know there's been a lot of questions related to collecting eligibility documentation. I know that Dceo as well as some LWIAs are researching tools. Case managers have the opportunity to upload eligibility documentation to IWDS, but the trick there is how do you get the documentation to the case manager? So we're, kind of looking at some tools for that. And just wanted to kind of hear from you some of the challenges that you have, or any innovative practices that you put in place that you can share in terms of service delivery, particularly with rapid response. Anything that we as Dceo can do to help mitigate some of your challenges. I know that's a lot. And we didn't really prepare you before this call to report out on that information, but wanted to at least give you an opportunity to do that. So I think in order to try to do this at least a little organized, we would just we're going to do like a roll call by LWIA. And if you don't have anything to share or you're not comfortable, you can just let us know that. But I would say if you do have something to share, make sure you unmute your phone. With that, and then I should say after that, we'll address the questions that you submitted in writing prior to the webinar for those that we haven't already addressed. But anyway, so can we begin with LWIA 1? Is there anyone from LWIA 1 who has anything that they would like to share with the group?
This is Damar Harris with LWIA 1. I believe we're just trying to look at different ways of how we address the individuals that are currently furloughed compared to those that are permanently laid off. And so we're just trying to look at what are the different tactics that we should be deploying for those different groups, still understanding that they're both laid off. So just at this point in time, we're in a research phase. We're really just listening to employers, and then from there, we plan on implementing different tactics and solutions to move forward. So I think right now we're just kind of listening while we're deploying our general career services virtually, but trying to figure out, is there additional services, or is there a different way of addressing someone that is temporarily laid off and they're not asking for employment services at this time because they're on furlough? How do we work with those individuals? So that's about it.
Great, thanks, Tamar. What about LWIA 2?
Hi, this is Julie Courtney. Can you hear me?
Yeah, thanks, Julie.
Hey, thanks, Annie. We're in a similar situation as LWIA 1. We have not really heard of any permanent layoffs at the moment. We have had some temporary ones, and we've sent information virtually through electronically to those companies. One of the things I think would be very helpful for Dceo, and I talked to Ron about this a little bit the other day, is you've asked each LWIA to come up with a PowerPoint. Since this is a lot of data that is a baseline throughout the state, I would suggest that maybe Dceo or the Worknet team could create a basic PowerPoint or basic video for rapid response services that include everything we need to know, and then have the local areas be able to customize that for more local resources, contact information. Then that way, I think you can really make sure everyone's following the state rapid response policy, and that we're all delivering a consistent message. Because I'll tell you, that nice woman who did all that stuff on the worker benefits, I would never even remember half of that stuff to be able to include in a PowerPoint. So that would be my suggestion, is how Dceo and Worknet could help us. And our big thing right now is we've had most everybody calling who's having issues connecting to UI and having lots and lots of problems there that we're unable to help, which seems to be the first triage, is getting them applying for unemployment, getting them through the system. And then like LWIA 2 or LWIA 1, we're looking at how do we work with those that are going to be on permanent layoff versus those that are thinking that they're going back to work in the near future.
Great, thanks, Julie. Just to address your suggestion too about Dceo creating a basic PowerPoint, that's certainly something that we could do typically, or consider doing. What we typically do is the IDES representative provides us with slides for the IDES portion of their presentation, and the if it's in the northern region, it would be a DOL EBSA, or in the central and southern regions, it would be Illinois Department of Insurance, and they each prepare their own slides. So you wouldn't be expected to provide the information like that we heard about today. Someone from EBSA would be doing that, and then we can put those all together. When I was talking about LWIA presentation, it was just specific, like in a normal in-person rapid response workshop, the LWIA does a portion of the presentation, really talking to folks about what services are available and how to direct traffic. And I think that's what we're thinking in terms of putting together the LWIA portion of the presentation, is that, you know, if you need to update that for, you know, websites or how you're directing traffic. And then I know we've had a number of requests from folks, could we put together sort of a generic webinar and post it online on Illinois Worknet or somewhere that we could direct employers or individuals. We have recorded one. We have hesitated to put it online, and it's something that we're still considering. One of the reasons that we've hesitated is that despite the fact that we're sheltering in place and that we're attempting to deliver services virtually, we wanted to be careful about, you know, the expectation is that we're going to customize and respond to organizations and companies experiencing layoffs, you know, with information specific to their company. And I know that in this day and age that might be a little bit difficult, but that's something we're taking under consideration. We do, if you do a rapid response webinar, we are recording those, and we are posting those on the company specific pages so that employees who may not be able to attend a webinar could go and watch the webinar that was put together for their specific company. Some of the things that we were thinking about were, you know, like questions that may appear in a chat pod that get addressed that are specific to a company. Sometimes employers like to join us on those webinars and address questions that are, you know, specific to their company layoff. So it is definitely something we're taking under consideration, and we'll keep you guys posted. Thank you, Julie. Elia 3.
Yes, hello, this is Chris. Can you hear me?
Yeah.
Hello.
Hi, Chris.
Hi. We are working, I think, through some similar things as the other LWIAs. We are doing, obviously, rapid response remotely, as it sounds like everyone else is doing. We're also working, I know there's a call right now going on amongst our providers and the board, just in terms of the best way to capture signatures of participants and doing that in the manner that meets compliance, and then just really trying to continue to get a handle on the best way to serve participants remotely, which is all, I think, brand new for all of us, as well as continuing to try to provide some services through the one-stop center. I know, again, with all the AJCs being closed, that's a bit of a challenging process. So just trying to figure out the best way to reach participants remotely and online to continue to provide those services to them.
Okay, great. Thank you, Chris. In terms of signatures too, I know some LWIAs have looked into tools or services like DocuSign, and there are some others out there, and Dceo is also doing some research on that, and I'm sure, you know, we'll provide updates as soon as that becomes available. LWIA 4.
This is Diana Schuler from LWIA 4. We've seen a good many temporary layoffs across our 8 counties, across all industries. We did have 2 events that were announced prior to the current healthcare crisis that we have subsequently provided electronic packets of information through Martha McDermott. We would be interested in using Worknet for a rapid response workshop, and we'll plan to get with Martha to get that going immediately. We are trying to connect with those that are on temporary layoff, because we do have a number of distribution centers and big box groceries that are looking for assistance. And just to kind of reiterate what Julie said, I think that at least a standardized PowerPoint would be awesome, something that we could actually use when we do in person, but also would be great to have so that everybody is actually getting the same information no matter where they're at. Thank you.
Great. Thank you, Diana. LWIA 5. Anyone from 5 on the line? Okay. LWIA 6.
Hi, everybody. It's Susie from LWIA 6. Can you hear me okay?
Yeah. Go ahead, Susie.
Well, we had yesterday afternoon our very first webinar for rapid response with a WARN event, Journey Care. And Journey Care was already a WARN event that we were working with prior to the stay in place order. And we actually had an on-site workshop scheduled, which then got canceled and moved to the webinar yesterday. And that was excellent. I really liked the chat box, because the chat box allowed us to download then important brochures and documents, and actually our application form, where we could then instantly connect with those affected workers and get them engaged in services with our office. So that went really well. I do want to just note that our office has been using a PowerPoint presentation in rapid response for about, I don't know, 6+ years now. We find it to be just that visual support to the individuals that are attending the rapid response workshops, seeing that we're giving them so much information. Again, it provides that visual support, just kind of pushing that message home. So I'd be happy to speak with anybody individually if they have questions about putting together their PowerPoint or what ours looks like. But I will also say that we have one PowerPoint that covers the 3 agencies, so the LWIA, U.S. Department of Labor, and then IDES. But again, DOL and IDES provided their slides, which were incorporated into one PowerPoint presentation.
Great. Susie, there was a question in the chat box asking what platform did you use for your webinar?
So we use Zoom, and actually Ron Johnson, hi Ron if you're on the call, Ron Johnson organized that with Marcus, is it Marcus Latham with IWN?
Correct. Yep.
One of the Worknet staff, yeah. So Marcus from IWN provided the technical support for it. And then Ron, myself, Scott Miller, and Mary Garcia were the presenters. And like I said, it went really well. We had about 30 plus participants on the webinar. And then I will also note tomorrow afternoon, we have a second one for Art Van Furniture. So we'll see how that goes.
Great,
and
thank you, Susie.
I mentioned one more thing, I apologize.
No, that's okay.
We're also getting multiple notices on a daily basis right now for employees that are furloughed or impacted by the virus. And so we're right now in the implementation stages of putting together probably a bi-weekly kind of orientation or information session. And essentially what that would look like would be a non-company specific rapid response workshop. So again, it would be the LWIA, Department of Labor, and IDES providing that pertinent information as one is entering their job transition. And again, what we're hoping to do is to get something implemented here in the next few days and get that information up onto our website in regards to how an out of work person or someone impacted by COVID, how they could then schedule to attend one of those rapid response workshops, webinars, I should say.
Great. Okay, thank you, Susie.
You're welcome.
LWIA 7.
Hi, everyone. This is Phaedra, Director of Business Relations and Economic Development for Chicago Cook Workforce Partnership, LWIA 7, Chicago and Cook County. We have received more than 60 WARN notices in our area with a combination of temporary furlough and permanent layoffs in some of them. By large volume, most of them are hotel properties or hotel adjacent. A few manufacturing, very small, maybe less than 5, I think. But mostly hospitality related. So. And restaurants, so significantly impacted by the COVID-19 and the measures required for health and safety right now. At the same time, so we are conducting virtual webinars. In some cases, many of the hotels had already closed, hotels, restaurants, et cetera, had already closed by the time a warn was received for us in our area. So we're doing follow-up, and in some cases, I know Annie mentioned earlier about receiving employee lists. We have received employee lists and are working to have our AJCs, dislocated worker funded sites, do outreach to those individuals. Our sites are all working, teleworking like everyone else, virtually and using phone screens to virtually connect people who want to be employed during this time, whether they're temporarily laid off or furloughed, and definitely those who are permanently laid off. we're connecting them to opportunities, and we've established a space on our own website. It directs them to resources, but also to hiring opportunities. So we're sharing all of that. We've also talked with, thanks to work with Dceo, talked to some multinational organizations, their HR leadership for the state, the region, or the country, about what they're doing and how we can connect our resources and our particular digital materials to their employees. Some companies have a specific page in their intranet for their impacted employees, where they are also developing virtual workshops for those employees. We too will have things posted, virtual workshops, and a schedule that will be posted to our website. So we'll be sharing that information as well.
Terrific. Thanks, Phaedra. Elias 10.
Hi, this is Susan Plessner, Workforce Services of Will County. It's never good to go after Cook County because we've had 8 WARN notices filed in the last 8 days, which seemed like a lot until I heard Phaedra speak. But we too have seen a combination of permanent layoffs and what they are, at least at this time, calling temporary layoffs. Our biggest concern, obviously, is that those temporary layoffs will turn into permanent layoffs. So we're kind of gearing up for that. And we're working with Carmela to figure out how to do some virtual rapid response workshops. Haven't quite got that figured out yet, but glad to hear what everybody else is doing and get some ideas that way. We've also had a lot of questions about unemployment, which we're forwarding that information to our Wagner-Peyser colleagues who work at the Workforce Center, and just continuing to offer career services, resume reviews, online workshops, Facebook Live workshops, and trying to push a lot of information out via our social media channels. That's all I have. Thanks.
All right. Thank you, Susan. LWIA 11.
Hi, it's LaDonna Russell. We are doing stuff very similar to what the other LWIAs are doing. We haven't had, thank goodness, and I'm knocking on wood, a very formal WARN notice yet. We've obviously seen temporary layoffs in the hospitality industries and so forth, trying to connect those workers with employers that are in desperate need with employees. So we're doing a lot of Facebook posts, getting it out to our chambers, getting it out to anybody that, you know, talks to businesses and so forth. We're also working with employers and letting them know, small businesses, about all the small business programs out there right now, all the SBA, the loans, and all the programs for that, trying to get that information out to small businesses. Again, our biggest issues are tape testing and kind of like eligibility, document, you know, how to get the documents and signatures. Current clients, though, we're registering them for summer semester, getting the ITAs processed, and so forth. So we're figuring it out as we go, as everyone else is.
Yeah. Thanks, LaDonna. Okay, LWIA 14. Nobody? All right, LWIA 15. Anyone from 15 on the line? Okay. 17?
This
LWIA
is Norm
17?
Griffin, LWIA 15.
Oh, I'm sorry. Go ahead, Norm.
Oh, it's okay. Sorry, I had a little bit trouble getting in there. So we've been experiencing, as everyone else, kind of the same pattern. A lot of hospitality, a lot of restaurant. We do have some manufacturing in our area. We had one major employer. We're not completely sure we can tie it to the cornid virus, just because they've kind of tied it more to slowdowns, but it's kind of an effect rather than a cause. We do continue to monitor daily. We've been in contact with our EDC. They've been wonderful about keeping all of us kind of up to date and informed. We are getting resources daily. I know probably everyone on this call is being flooded with emails. Sometimes it's hard to keep up. We do try to post them on our Facebook page. We are directing people to the EDC because they've got a lot of good information. And that's about what we're doing. We do continue to reach out virtually. We've had a couple businesses that have furloughed or laid off temporarily in our area. We've had a couple that have been permanent as well. We have forwarded information via email. I am very interested to learn about doing a PowerPoint presentation. I think that could be very useful for us.
Great. Thank you, Norm.
Thank you.
Elia 17? Is there anyone from 17? Okay. 18? Elia 19? Elia 20? Nope. 21? Uh, 22? LWIA 23? 24? Oh, I'm sorry. Was someone from 23? No. 24?
Hi, this is Monique from LWIA 24.
Hi, Monique.
Hi. Well, I was just listening to everyone else. We actually operate from the One Stop. So our areas are not getting a lot of calls at this point to determine who's permanently laid off or short-term laid off. But we did have a rapid response prior to the COVID-19 situation. And so at this point, we're kind of waiting to see how we're gonna progress with those customers that we had already met with, trying to get them processed and things like that. So we still have some time, but we're gonna be working with, I guess, the DOL and the teams to see how to proceed with those customers, because you know, hopefully we're looking to go back to work hopefully soon, but at this point we're limited on how to make access. So we're kind of looking forward to see if any of those recommendations will be made as well.
Yeah, and I expect and look forward to that as well, Monique. I know information's being sent out pretty much daily. So thank you for that. Elia 25? Anyone from 25? What about 26?
Hey, this is Pam Barbie from 26.
Hi, Pam.
Hey, in 26, we're reaching out to the businesses that we have the most of, those small businesses here in these 14 southern counties. And we're just reaching out to them by whatever means we can find. Social media. I've done a few radio interviews. We still have quite a few local radio stations in the South. So just trying to get information out to them so them and their employees are prepared for whatever resources we can find for them.
Okay. Great. Thank you, Pam. And thank you everyone for sharing that information. It sounds like, you know, a lot of us have the same challenges, but I hope, you know, in listening to each other, you kind of found either some comfort in that or, you know, got some ideas to help out moving forward. And I noticed that Susie Pahara from LWIA 6 published her or put her contact information in the chat pod if anyone is interested in reaching out to her related to PowerPoint presentation as well. And then we'll also get back to you on the suggestion about Dceo putting a standardized presentation together and keep you posted on that. Brian, is there anything you want to jump in here with, or should I jump into the Q&A, or?
No, we can go to the Q&A if you want.
Okay. So as we asked you guys to do, is if you had specific questions you wanted to address, if you could submit them before. And in about the 15 minutes that we have left, kind of want to address some of those questions. And just realizing that we don't have answers to all of them, but as information becomes available, we'll certainly share. So one of the questions was, I've noticed there's no desk number assignment currently being done in IWDS, and wondering, you know, when a desk number would be assigned and what the impact of that is. We talked a little bit earlier about, you know, the backlog and that we are working on it, and we'll update everyone as soon as we are, you know, kind of caught up. It is true that you cannot get a company-specific page built on Worknet till the desk event is set up. So if you have one that needs to be a priority because you have a workshop coming up or you need to get the page set up right away, again, reach out to your Dceo rapid response rep and let us know, and we'll expedite that for you. The next question was, can affected worker contact information be requested from each company that has been impacted, so that we can share that with the LWIA for outreach and recruitment? And again, that's kind of standard part of our rapid response, that we typically ask for that information at an initial meeting. And some employers are willing to share and some are more reluctant. We're hoping that the Survey Monkey, that we're able to provide you with that contact information at the end of a webinar, so you could sort that and outreach that way. And then, let's see. Bear with me. There are a question, a manufacturing company asked if they paid their employees wages at 60%, can the government cover the balance to make employees whole? There is some information out on the Dceo website, and I'll show you their address on the next slide too, but they've updated the Dceo homepage for information specific to businesses, and there's a lot of information there about the Small Business Administration programs, as well as State of Illinois grant programs, small business loan programs. And I'm not sure of the answer to this specific question, but I did see reference to that in some of the information that's posted on the Dceo website. So I don't know the exact parameters of that, but that's definitely something that looks like it could be a part of one of those programs. So let's see, there were some other questions here. Bear with me just a second. So some questions related to incumbent worker training. Can the requirement that employees be, you know, the majority of employees in a cohort, or the employee be employed with that employer for a minimum of 6 months? This was one of the questions that Dceo submitted up to DOL to ask about, and we are awaiting their response on that. So don't have an answer yet, but we definitely have asked the question. Next question was, can warn notices come, this is the same with addresses of individuals, so that direct mailers could be sent out. That information is on the surveys, on the SurveyMonkey webinar information. Again, we do ask employers for that, and some are willing to do that and some are not. But when we get them, we will definitely share with the LWIA or that are appropriate. Can the state get access to employers that apply for small business administration services, which would provide a warm lead for LWIAs to follow up? We've asked this question, but we'll have to get back to you because I haven't received a response yet. On the and the next question we talked about, it was related to generic presentation. The next question was, if an individual who is participating in on-the-job training was laid off from one employer and Employment Services identifies another possible on-the-job training employer, could that individual receive 2 OJTs during this crisis? And then the same thought for work experience as well. And for that question, you know, I would say there is nothing in IWDS that would prevent you from closing one OJT service and opening up a new service. And I wanted to give you some initial thoughts on this. So if the customer was enrolled in OJT but was then laid off, and then the customer would no longer be enrolled in the OJT. Does the customer anticipate they'll return to that job? If the answer is yes, then enrolling in another OJT may not necessarily make sense. But if the customer is not going to return to that old job and the LWIA has identified a new job that met all of the requirements for OJT, so, you know, it was demand occupation, had sustainable wages, that sort of thing, then I think that could be allowed. The OJT would be appropriate for temporary employment if the customer needs temporary employment and it's part of the COVID-19 disaster response. We may be able to provide some rapid response funds, or if the Illinois National Dislocated Worker Grant funding is approved for disaster relief employment, that could pay wages of workers that are supporting the disaster response efforts, including things like providing humanitarian aid. And in terms of work experience, I think that multiple paid work experiences are allowed as long as the LWIA follows the regulations for each work site. So that includes things like the general limit regarding the number of hours worked. I think the LWIAs would need to consider both work sites when considering the total number of hours. And I think it's important to remember that the primary purpose of the paid work experience is to provide training in a workplace setting to the job seeker. So if the primary benefit of the work experience is to the employer, then it's no longer really an allowable work experience, rather than, you know, providing the training. So I think those are the primary questions that we received that were not already addressed in the webinar. What I would ask is if you could, David, just switch to the next slide. You know, as additional questions become available, and I see there are a couple more questions in the chat pod. But if you have additional questions, you can see up on the screen contact information for Brian, Ellis, and me. And the other thing I would encourage you to do, you see the Dceo website up there on the bottom of the screen. So we've been directing a lot of businesses to the Dceo website. It seems to have sort of a good place where there's a compilation of a lot of information from various sources that they've put out there, and it's pretty easy to navigate from what I've seen. So if you haven't already, I would encourage you to check that out. Let's see, I just want to check the chat pod here. Okay, a couple of updates from some LWIAs, it looks like, on there if you're interested. And then if the previous OJT encompassed 1,000 hours and then was laid off permanently, the individual could receive 1,000 hours at a new OJT employer. Let me check that out, I'm not sure. And I think that kind of brings us to the end of the webinar. Brian, was there anything that you wanted to add?
No, Annie, thank you. We just want to express our appreciation to everyone who jumped on the webinar this afternoon. We appreciate your comments and your feedback. I just want to add, if you have additional questions or feedback or information that you want to share with us or with the group, please feel free to reach out to us, and we appreciate all the work you're doing. Thank you for your time, and please be safe out there.
Yeah, great. Thanks, Brian. I think that brings us to the conclusion of the webinar. We did go the full 2 hours, and I guess I would just like to add my thank you to the IDES folks who really can't say enough about how much we appreciate your hard work and all you're doing at this crazy time, and also to Lisa Stromek at EBSA for agreeing to participate and share information. And again, just add my thanks along with Brian for all of the hard work that everyone is doing. And again, please be safe out there, and continue to watch for updates and let us know how we can help you. Thanks, everyone.